very familiar face, Carol Behne from CAHA. Carol manages the Climate and Health Alliance Sustainable Healthcare Program, which includes coordinating the Global Green and Healthy Hospital Network in Australia and in New Zealand. She has previously worked as a speech pathologist in local council energy efficiency and solar programs and in the green roof and wall industry. Please join me in welcoming Carol.
Hi everyone. Thanks Grace, and thank you Jane for going through that report. Oopsie, back to the beginning. So what I'm going to go through today is the Healthcare Climate Challenge, which is an initiative of Healthcare Without Harm that demonstrates what healthcare is currently doing and what it is capable of doing in acting on the findings of the report and the conclusions of the report. So the Healthcare Climate Challenge is based around 3 areas: mitigation and reducing health sector's own carbon footprint in scope 1, 2 and 3, as well as improving resilience and preparing health services for extreme weather events and a shifting burden of disease, and leadership as well. So educating staff and patients about climate change and advocating for effective policy for protecting health from the impacts of climate change. Challenge participants choose targets in each of those 3 areas and then track their progress towards those targets. At the moment, there are over 200 participants taking part in the challenge from 31 different countries all around the world, and they together represent 18,000 hospitals and health services, and together they've committed to reducing their emissions by 34 million tonnes of CO2 equivalents per year. So to put that in perspective, that's the same amount of emissions that would come from 1 year from 9 coal power plants. To date, participants have achieved reductions of 6.8 million tonnes of CO2, and importantly, they've also reported saving $394 million from energy efficiency programs and renewable energy generation. The challenge aims to engage health institutions to commit to climate action, to measure the collective health carbon footprint reductions, to showcase successes, to scale up the development of climate-smart health services all around the world, and to mobilise healthcare to play a leading role in advocating for a healthy climate. The challenge includes an annual awards program that recognises participants that are at the forefront of delivering climate-smart healthcare. And in our part of the world, 3 health institutions recently won awards. They are Uniting Care Queensland, who won a silver award for leadership. They've reduced their carbon footprint by 4% on 2017 levels through installing solar energy efficiency programs and upgrading their passenger vehicle fleet. And they've also committed a further $3.5 million to more energy efficiency programs across their sites by mid-next year. Auckland District Health Board in New Zealand, they received gold awards for mitigation, resiliency and leadership. They've reduced their electricity usage by 2.8 million kilowatt hours over the last 12 months through an energy management program. So that's the same amount of electricity that just under 400 New Zealand households would use in 1 year. They're also very involved in assessing and improving their resiliency in a number of ways and collaborating with many different stakeholders and agencies. For example, the Auckland Civil Defence Emergency Management Group. Then also in New Zealand, Counters Manukau District Health Board, they've won a gold award for leadership and a silver award for mitigation. And on top of their work to reduce emissions, they also run education and awareness programs for staff and patients around climate change. And they're also really engaged in developing regional supply chain and procurement criteria that focus on carbon reductions, but also on social and ethical dimensions. So a big round of applause to all of you. The people from New Zealand might be listening in today. We are streaming, so if you can hear us, well done. I invite all of your health institutions to also take part in the challenge so we can collectively demonstrate what the health sector is currently doing, but also push for more action in this area towards providing a safe and healthy future. As an added bonus, any health institution that takes part in the program also automatically becomes a Global Green and Healthy Hospitals Network member, which is a worldwide collaborative network of health institutions that are working to reduce their environmental impacts. And membership in GGHH provides access to a whole range of support that helps you further environmental sustainability and health, as well as connecting you with a room full of people like yourselves that are working in this space. Global Green and Healthy Hospitals is an initiative of Healthcare Without Harm again, and as Jane was saying earlier, the Climate and Health Alliance is Healthcare Without Harm's strategic partner here in Australia, so we all coordinate Global Green and Healthy Hospitals in Australia and New Zealand as part of our Sustainable Healthcare Program. So if you'd like to know more about the challenge or about GGHH, jump in